Hello, my name is Olga Luzon, and I'm a senior lecturer and senior clinical tutor here at the Doctorate in Clinical Psychology at Holloway University. Quite often people ask me, how do you become a clinical psychologist? What do you do as a clinical psychologist, and what's the training involved? So I just wanted to answer a couple of those questions for you today. Basically, a clinical psychologist is a mental health professional that works with a range of difficulties, emotional, psychological, behavior difficulties that people may experience in a range of contexts, which could be in primary care settings, working with GP practices and working with health visitors, or it could be in secondary care or hospital and inpatient. So it's quite a range of settings where we are based, really. And we work across the lifespan. So that means that we work with children, we work with adolescents, we work with other adults, and also with older adults. So we are trained, and we do go on placements to become trained on and develop competences to work across the lifespan and with a range of complexity and difficulty. So it could be anything from working with people's experiencing anxiety, depression, low moods, eating disorders, all the way to more bipolar difficulties or psychosis experiences and so on as well. But we are also involved in supporting policy development, in public health as well, and prevention, promotion of well-being as well. So how do you become a clinical psychologist if you want to be a clinical psychologist? You first need a good bachelor degree that's providing you a good foundation in psychology. Often the 2-1 or a first is advisable, and then you require a bit of experience on research and clinical experience. So you could some people do a master's or a postgraduate diploma in research, and or you could also get some experience working as a research assistant. So that gives you an understanding of what research is and the importance of the empirical method as well. And then also some experience in clinical settings. That could be paid or unpaid, it could be placement, but often people may work for about a couple of years, 2 to 3 years after graduating from a bachelor, before they access the course. Once you get into the course, at the moment it's a paid doctorate, so that means that you are paid while you're doing the training at the same time. 2 days a week you'll be based with us or at university, doing lectures and taking part in academic activities, and then 3 days a week you'll be based on placements. And as I said, those would be moving all across from mental health to child, to learning difficulties, other adults, and so on. So you'll get a really good comprehensive training, and it's a doctorate level, which means that you'll also be doing your own research, more, your empirical piece of research, but also systematic review and so on. So it really equips you to be able to use evidence-based practice as well. I hope this is helpful. Good luck.